In this video, we will be discussing Tenoretic 50, a medication used to treat high blood pressure, also known as hypertension. By lowering high blood pressure, Tenoretic 50 can help prevent strokes, heart attacks, and kidney problems. This product contains two medications, Atenolol and Chlorthalidone. Atenolol belongs to a class of drugs known as beta blockers, which works by blocking certain natural chemicals in the body, lowering the heart rate, blood pressure, and strain on the heart. Chlorthalidone, on the other hand, is a diuretic, or water pill, that helps the body get rid of extra salt and water, while also relaxing the blood vessels to improve blood flow. These medications are used together when one drug alone is not controlling your blood pressure. Your doctor may direct you to start taking the individual medications first, and then switch you over to this combination product if this is the best dose combination for you. It is important to follow your doctor's instructions on the daily dosage and optimal timing for taking Tenoretic 50. When taking Tenoretic 50, it's important to follow your doctor's instructions. You can take this medication with or without food, usually once daily. It's best to take it at least 4 hours before bedtime to avoid waking up to urinate. Avoid drinking apple or orange juice within 4 hours of taking this medication, unless your doctor or pharmacist tells you otherwise. The dosage will depend on your medical condition and how you respond to the treatment. Take it at the same time each day to get the most benefit from it. If you take cholesterol-lowering drugs, make sure to take Tenoretic 50 at least 2 hours before or 4 hours after those medications. It may take several weeks before you feel the full benefit of this medication, so keep taking it even if you feel well. If your condition does not improve or worsens, such as if your blood pressure remains high, be sure to consult your doctor. Some common side effects of Tenoretic 50 may include dizziness, lightheadedness, tiredness, nausea, and diarrhea. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, it is recommended to get up slowly when rising from a sitting or lying position. This medication may also reduce blood flow to your hands and feet, causing them to feel cold. Smoking can worsen this effect, so it's advised to dress warmly and avoid tobacco use. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. The chlorthalidone in this product may cause dehydration and electrolyte imbalance. It's important to inform your doctor right away if you experience symptoms of dehydration or electrolyte imbalance, such as extreme thirst, very dry mouth, muscle cramps, weakness, fast/irregular heartbeat, or confusion. Serious side effects that should be reported to your doctor immediately include very slow heartbeat, fainting, trouble breathing, signs of kidney problems, toe/joint pain, mental/mood changes, blue fingers/toes, and new or worsening symptoms of heart failure. If you experience very serious side effects such as a decrease in vision or eye pain, it's important to seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to get medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. It is important not to stop taking Tenoretic 50 without consulting your doctor, as suddenly stopping the medication can worsen certain conditions. Some people who have suddenly stopped taking similar drugs have experienced chest pain, heart attack, and irregular heartbeat. If your doctor decides that you should no longer use this medication, they may direct you to gradually decrease your dose over 1 to 2 weeks. When gradually stopping Tenoretic 50, it is recommended to temporarily limit physical activity to decrease strain on the heart. If you develop chest pain, tightness, pressure, or if the chest pain spreads to the jaw, neck, or arm, experience unusual sweating, have trouble breathing, or have a fast or irregular heartbeat, seek medical help right away. Before taking Tenoretic 50, make sure to tell your doctor or pharmacist if you are allergic to Atenolol or Chlorthalidone, or if you have any other allergies. It's important to discuss any inactive ingredients that could cause allergic reactions or other problems. You should also inform your doctor or pharmacist about your medical history, especially if you have liver or kidney disease, certain heart rhythm problems, gout, lupus, breathing problems, blood circulation issues, untreated mineral imbalance, serious allergic reactions, or a certain muscle/nerve disease. This medication may cause dizziness, and alcohol or marijuana can make this effect worse. So, it's important not to drive, use machinery, or do anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, make sure to talk to your doctor about it. Dehydration due to excessive sweating, diarrhea, or vomiting can increase your risk of dizziness or lightheadedness. If you experience prolonged diarrhea or vomiting, be sure to report it to your doctor and drink enough fluids to prevent dehydration unless your doctor directs you otherwise. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication may reduce the potassium levels in your blood, so it's important to ask your doctor about adding potassium to your diet or to prescribe a potassium supplement. Tenoretic 50 may prevent the fast or pounding heartbeat you would usually feel when your blood sugar level falls too low. If you have diabetes, the risk is higher, and other symptoms of low blood sugar levels, such as dizziness and sweating, are not affected by this drug. If you have diabetes, this medication may make it harder to control your blood sugar levels, so be sure to check your blood sugar levels regularly as directed by your doctor and tell them right away if you have symptoms of high blood sugar. This medication may also make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. Older adults may be more sensitive to the side effects of this drug, especially dizziness. If you are pregnant or plan to become pregnant, discuss this with your doctor, as Atenolol may harm an unborn baby. This medication can also pass into breast milk and may harm a nursing infant, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Tenoretic 50. Some products, like dofetilide, fingolimod, and lithium, may interact with this medication and could change how it works or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also important to tell your pharmacist about any products you are using that could raise your heart rate or blood pressure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen/naproxen. Additionally, Tenoretic 50 may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you are taking this medication. If you or someone else has taken too much Tenoretic 50 and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. Symptoms of overdose may include severe dizziness, fainting, very slow heartbeat, and trouble breathing. If you're in the US, you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center. It's important not to share Tenoretic 50 with others. To help Tenoretic 50 work better, you may want to consider making some lifestyle changes, such as participating in stress reduction programs, exercising, and making dietary changes. If you're interested in making these changes, be sure to talk to your doctor or pharmacist about what might benefit you. While taking Tenoretic 50, it's important to have lab and/or medical tests done, including tests for kidney function and blood mineral levels such as potassium. It's important to keep all medical and lab appointments, so be sure to consult your doctor for more details. It's also important to have your blood pressure and heart rate checked regularly while taking Tenoretic 50. You can learn how to check your own blood pressure and heart rate at home, and be sure to share the results with your doctor. If you forget to take a dose of Tenoretic 50, take it as soon as you remember. However, if it's close to the time for your next dose, just skip the missed dose and take the next one at the regular time. Do not take a double dose to make up for the missed one. It's important to store Tenoretic 50 at room temperature, away from light and moisture. It's also important to keep it away from the bathroom, and out of reach of children and pets. When it comes to discarding Tenoretic 50, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, it should be properly discarded when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.